Hi, welcome to the Legislators Lounge. I'm Jim Webb, the host of the show, and my co-host is Brian Chericello.
Hello.
Today with us we have Representative Jack Flanagan, who's the Majority Leader of the House, and we have Representative Cindy Rosenwald, and she is the Deputy Minority Leader.
Yeah.
Get that right.
Welcome to the show.
Thank you.
Thank you.
What we usually do when we start is we try to get some background about you for the public. So why don't we do that, and we'll start with Representative Rosenwald.
Well, thank you for having me here. I'm from Nashua, and I'm in my 6th term. The first 3 terms, I was on the Health, Human Services, and Elderly Affairs Committee, and this is my 3rd term on the Finance Committee. As you know, we divide that committee up into 3 sections, and I'm on the Health and Human Services part of the Finance Committee.
Very good. Jack.
This is my 3rd term. My first 2 terms were on the Labor Committee. Currently serve as the Majority Leader, so that's pretty much a full-time job. I represent the towns of Brookline and Mason, and just have had many positions in town, but this sort of led to where we are now.
Great.
All right, well.
First question, Jim?
Yeah, we might as well. Well, Jack and I had sat next to each other last year, so it's kind of like old buddies getting together again here. But, you know, the House this year, this is also our 3rd term. Right. So the House this year has had its ups and its downs, and it's kind of been like a roller coaster ride. I just wanted to kind of get your thoughts on what you think, where we are, if we need improvement, where we need improvement. We seem to be rolling through the bills at this point.
Yeah, you want to go, Representative?
Well, I think the ups and downs are more within the Republican caucus than within the Democratic caucus. I mean, you could say that there are 2 Republican caucus, but we don't have that issue. Our sense is that the process has been fair, pretty transparent, and I think what the public deserves. I think it's been dignified. Yeah. We feel we've been treated fairly by the Speaker. We haven't been blindsided on anything. We feel that we've been kept involved. I think the policy is a little more problematic for us.
Right. I would have to agree with Representative Rosenwald, is that, but also what you said is, in the beginning, it was bumpy road. I mean, there were a lot of hurt feelings, and for the people at home, there was basically a battle for the speakership. Representative Jasper from Hudson, local town, prevailed, and so there were some hurt feelings there, and it was a little bumpy. But I think once committees were established and bills started getting debated, that things settled out. And I think a big challenge that, as Republicans, was the budget. And you've heard different renditions of the budget, but the budget was a pivotal point, I think, with leadership at this point in time.
Yeah. So let's get into some of the issues. One of the big issues we just talked about not that long ago was the casino gambling bill. It seems that comes up every term, so I want to get your take on that, as far as what you thought. You know, was this bill any better than previous bills? I mean, can we improve on it? What's your thought on that?
I'm going to defer to you, because ladies first.
You know, I think the casino bill is very interesting because it is probably one of the very, very few issues that is completely nonpartisan.
Yeah.
And as we didn't try to urge our caucus one way or another, and I think that's true in yours as well from everything I heard. And interestingly, pretty much the same percentage of both Republicans and Democrats voted for it and against it. So I mean, it was 44%, I think, of our caucus, and
Probably roughly the same
and 42% of your caucus. So I mean, very, very close. For me personally, I'm not I'm not a fan of giving away money in advance. I believe that the public elects a huge legislature every 2 years and gives them the responsibility to budget the money to determine where the spending priorities are.
Right.
So for me, a stumbling block was the revenue sharing provision.
Oh. So you thought maybe there could have been a more take for the towns? Is that what I'm hearing?
I would have preferred
Yeah.
to put more money in the general fund
Oh, okay.
rather than the cities and towns, and let the people who are elected every 2 years determine where the spending
Right.
priorities are.
And can I ask you a question while we're still on that? You had mentioned there was no push with the party on that side, even though the governor has been very
There was
public in supporting. It's interesting to hear there was no push at all.
We are split the way you guys are.
Okay.
We have a split within Nashua. The Chamber of Commerce came out in favor of it,
Okay.
but the city government was really split, and our mayor is opposed to it. So
Interesting.
it's very nonpartisan.
Yeah, the mayor happens to be a Republican. I have a little different opinion. I was the one that introduced the revenue sharing piece.
See, there you go.
See, so Representative Rosenwald and I are not necessarily opposite, but we're, for the reason that she didn't like
Yeah.
is the reason that I liked. Because my very first term, if you may remember, when gambling was proposed, it was to eliminate or reduce BET and BPT.
Right.
And therefore I supported it. But the second go around, it was all going back to the general fund. So they asked how could they get my support, and it was give money back to the cities and towns. And that happened, but we lost by 1 vote last term.
Yes.
Right.
Yeah. That was
That's right.
close.
That was close. And this term, it got a little fuzzy on the revenue sharing. It's like, well, there's no guarantee. So I had made the suggestion, it didn't get incorporated, was to get rid of the statewide school tax in our property tax bill.
Oh.
So in other words, that money that comes in from gambling. So if you're a representative and you decide that you're going to take some of that money away, your constituents are going to see their taxes go up immediately.
Oh.
Yeah.
And they'll see it in that portion, and then you'll be answerable. But my position on gambling is as simple as, well, it's a business and they want to start it in New Hampshire. People want to participate in it. I don't gamble, but if
Yeah.
you want to, it might as well be here instead of some other state. So I didn't have any problem with it.
Now, why do you think it lost by such a big margin? And
This
time
time
around?
around,
That was
easy.
kind of surprising.
That's
I think.
an easy one.
Why?
Well, if you have a bill that's 102 pages long,
Yeah.
okay, you're going to find something you don't like.
Right.
You're going to find something you don't like. I may not like it, and Representative Roosevelt may not like it. So you have 4 no's
Yeah.
based on 4 specific-
Pages.
Yeah, or potentially 4
Out
pages.
of 100.
Right. So it's very easy, and then the reason you have may have 2 or 3 other people. So it's really hard to get a bill like that passed just because of the sheer volume of the detail.
Yeah.
I mean, that's my own personal opinion.
I have no idea.
Yeah.
No,
Really?
I had voted for the bill, and mostly because of my constituents, the constituents here in Derry, and we hear quite a bit from them, and they're saying, right now they're a little upset because it didn't get passed, but so they have to look to see who voted for it if you want to see why it didn't pass or who didn't vote for it, in some cases. But I think the bill last year was much better than it is this year.
So it was
but
one
I was
casino?
still wanted it,
Yeah.
which was the one that the governor supported. The only part I didn't like about last year's bill is that she used it as part of her budget.
Yes.
If she didn't do that, it would have passed because there would have been no problems, getting it through that way. And then the income could have been used for other things.
One
like,
vote. 1 vote last year. That was it.
It's amazing what difference a
I
year
know.
makes. I mean, my constituents are pretty split, the few that I've heard from on the issue, but the ones who have told me they support casino gambling have, to a person, said these state programs are important to me, and I think that casino gambling could support them. So that's why I say, for me, the general fund issue matters, because I'm not hearing my constituents say, I want casinos so my property taxes go down.
Right.
But, you know, it may not have affected our property taxes directly, and maybe there could have been other options, like Jack had mentioned, the thing about eliminating the statewide school tax. That would have been great, because then your property tax would have went down as a result of gambling. Direct relationship to your property tax, absolutely. So when you hear that, it's you know, it's things like that that bring our legislator together and makes us what we are. We are one of the best legislators in the country because of that, because of so many different points of views and ideas. It's unfortunate that they didn't accept that, because that would have been a win-win on everybody's situation.
Of course, it could have been overturned immediately in the next budget.
Right.
Yeah, that's one of the issues that we have, is that there is.
And you know, you hear multiple reasons. I mean, like we went down the line here, but I mean, there was issue of monopoly. There was issue of you know, the social costs.
Right.
The issue, what was it, the other ones? The one about the money. There's no guarantee the money would reduce taxes. Like a future legislature would take it away. And there was a couple of them. The charitable gaming.
Right.
There's already charitable gaming groups that rely upon.
Right. They didn't.
But what's going to happen to the charitable gaming, if Massachusetts gets that casino? Those people that are up here for the they're going that way, and I don't know what we're going to do, but.
And all of the woes of gambling are still going to be here, because our people are going to go to Massachusetts if they put one.
Yes, and they're going to bring their problems back home.
Right, and then we still have all the social needs that a gambling would have, casino would have helped with that, because it was written into the bill.
Let's talk about. Oh, I'm sorry. Go ahead.
I was going to say, if we didn't suspend those provisions the next
right,
year.
the next legislator. Right.
Like we do with the alcohol treatment fund.
Let's talk about the Medicaid expansion that we talked about. We actually that was the last term, I believe.
Yes.
That we brought in, and you know, they're talking about the sunset clause and how that's going to affect the budget and whatnot. So I'd like to get your take on that.
You first.
You want me to go first this time?
Yeah, because I don't stop talking about it.
Oh well, no. I mean, there's a lot of different ways to look at it. Some of the presidential candidates who happen to be governors, their rationale that have accepted Medicaid expansion is that it's already our tax money going to the federal government. They want to give it back to us. Who am I to say no to that money, knowing that it's going to help the citizens of my state?
Right.
Solid argument. You know, as Republicans, we don't necessarily support the whole concept of subsidized medicine as a whole. My big concern is that the current bill that we have, the legislation that we have, will expire June of next year.
December of next year.
Right, but our budget ends as of June of next year.
Right.
Yes.
So in other words, there's that window, that 6-month window from the end of from June to December.
Oh, our budget expires June of 17.
17.
But the program expires December of 16.
16. Okay.
So the issue, the point I'm trying to get is that the funding piece of this whole process, because there is some monies that come out of the state revenue, is none of our, I'm going to speak for the Republicans, want to spend money unless the federal government pays for it all.
Right.
The only other possible solution is the net beneficiaries of Medicaid expansion has been the hospitals under the uncompensated care. I think you'll agree with that, is that it's helped reduce that substantially.
Substantially.
And if we're going to continue with it, they may need to have to, you know, help offset some of those costs. That's my own personal opinion. It's not the Republican caucus.
Sure.
Well, I've looked at this in a couple different ways. First, from the perspective, I think we have to think about the almost 40,000 people right now who are enrolled in it. And I didn't stop to look up how many are in Derry. But in Nashua, for example, it's 2,500 people. It's thousands in Manchester. I mean, so we're talking about our poorest adults. It's not children and it's not the elderly. So from their perspectives, I think they personally benefit. Many of them, they're talked about as being able-bodied adults. However, that's almost not quite true. A significant percentage may have a mental illness or a substance abuse problem, not working enough to not be incredibly low income.
Okay.
With treatment, with mental health treatment, with substance abuse treatment, I think perhaps a majority of them could recover, be more productive, and work their way out of poverty.
Right.
But I also think that we have to look at it from the perspective of the healthcare system. And this is hard in southern New Hampshire, where our hospitals are pretty healthy financially. You go up north, and these hospitals are tiny. They're far apart. They have critical access designation from the federal government. Without them, you might have to drive for an hour in labor.
Yeah.
And to the extent that they are not paid for the care they are required to give, I worry about the financial sustainability of some of them. So it's a long way of saying I think that the Medicaid expansion will help stabilize our healthcare system. And in our top 15 employers, I think 11 of them are hospitals.
Right.
So it's a huge industry here.
One of the issues I have with the Medicaid expansion is in the bill itself that passed is that eventually the federal money goes away.
Yeah.
That means the people of the state of New Hampshire are going to have to foot the bill. And we already have the highest property tax. We need some sort of revenue generator if this happens. I mean, you're talking lots, 50,000 people's insurances. I mean, because they're going to be cut anyway because we're not going to have the money.
Well, I mean, when you say the federal money goes away, it goes from 100% of the cost to 95%, and then 90% of the cost. And to put that in perspective, the rest of our Medicaid program is mostly about a 50% state contributions versus the 10%. And I will say that the federal government has not once not made good on its Medicaid funding, and I know it's about to come out of your mouth about
I agree.
the
At this
education
moment,
funding.
no. You look at when you look at the big picture, and you see that the feds. I mean, we watched it. They couldn't come up with a balanced budget. And they kept blaming the Congress. But we can't fund this. There's sequester the whole thing.
Yep.
So that money is not absolutely guaranteed from our federal
But
government.
we could also get out of it with 90 days notice, basically. Forever. Yeah. So, I mean, it doesn't really tie us down. I think it's a good investment. I think it's low risk. They've never reneged on their contribution. In fact, during economic downturns, the federal government has paid states more. And during the huge recession in 2008, 9, and 10, New Hampshire was paid about $200 million more in Medicaid federal funds to help us.
Right.
The hard thing, though, is Representative Rosen was right, is that a lot of them are younger and they have issues. But if you look at statistics, 65% of the people that are receiving Medicaid expansion are under the age of 35 and have no children. Okay, so and I'm speaking from a partisan position at this point in time, is when we did the budget, it was Meals on Wheels and the disabled and the elderly and all this other stuff, but we spent $17 million for a group of people that were 35 years old or younger with no children, so they could have medical care. So it's a trade-off. I mean, we're taking money from a more dependent group, and hopefully, question is, should we have been giving it to that group in the first place? And that was the purpose of it. It was based on economics. The federal government said you make up at a certain level, therefore you would qualify. It's a slippery slope. I think it's one of those things that we'll have to wait and see what the federal government decides to do with the Affordable Care Act, to be honest with you.
It's a tough call.
And to Jim's point, we were talking about there's no revenues coming into the state. We saw that in HB 1 and 2 this year, where we did make the schools whole, but we took from Health and Human Services pieces of money that actually went on the other side of that.
Funds and
so the
Rainy
money
day
is
fund.
right. So how
rainy day.
even though it
highway
went from 100 to 95, we still need to raise that revenue. And
Absolutely, and that's what the governor's budget did, in a way that seemed to the Democratic caucus pretty mild. I mean, asking companies that are based offshore not to evade their business property taxes, that would not be a hard sell to my constituents.
Right, but what about the
The
increase?
cigarette tax,
What about
not a hard sell.
But Representative, that's a hard sell for me because I'm like yourself.
I'm a border
I'm
town
a border
as well.
town too.
Yeah.
I mean, literally, I mean, it's one convenience store. Almost all the parking is from
I know
Massachusetts.
that store.
Yes, and there's a liquor store there
Yep.
too.
Yep.
And then there was an increase in the registration fee, your car registration fee. And here's the trouble with that is that you say you have an elderly woman who doesn't really go out and drive that much. So if the gas tax went up, for example, it wouldn't hit her as bad. But if you start throwing in increases in registration fees and other taxes that were part of the governor's plan, that would hit her, the elderly, harder than something like a gas tax. And what we as Republicans decided is it was no gas tax and we'd have to find the money in different places. Now, it didn't make us happy, but at least the second step of the budget process, that is the House passed the budget, passed it off to the Senate, and then we'll get back in committee of conference, which I'm sure you'll probably attend.
I'll probably try to stay up late enough. I think it's going to be an interesting committee of conference because some of the provisions in the budget that you passed, if they went into law, and I'm thinking of the rainy day fund, we have been told that that would lead to an immediate downgrade in the state's credit rating.
Right.
Now,
the Senate side of things, they get to see revenues that we don't necessarily see. Is that correct? Like the April and
Additional
May?
revenue.
it is true, but it's also true that this year the Ways and Means Committee didn't take a second look at the revenues the way they usually do before the House budget is passed. So the revenues were looked at in January and they weren't looked at again in March. Revenues are going to exceed plan.
Okay.
Not by a lot.
No, well, 20 or 30 million dollars. Not a huge amount, but some. But a decision to look at revenues again would have had a higher base for fiscal year 15, and then higher basis for the next 2 years for a little bit of growth. So there would have been some revenue. The Senate's good at adding revenue.
I think there's some additional revenue out there that, I don't know, I'm not part of the Finance Committee like yourself, but I'm just saying that there may be some additional revenue that I'm hearing amongst the State House. Like, did you look here, did you look here? And I haven't had a chance to run that by Chairman Kirk. So.
I'm going to change it up a little bit here, and we're going to talk about something else. Now, I don't know how either one of you guys voted on this bill. I probably know how Representative Rosenwald did, but I don't know how you did, Jack. But the cell phone bill that we had last session, and then this session they tried to repeal it a little bit so it'll only affect 18-year-olds. At this point, New Hampshire will have the toughest cell phone bill in the entire country. You are not allowed to use Bluetooth, regardless of what they're telling you on the radio. The little Bluetooth in your ear.
Understanding.
You cannot use a Bluetooth in your ear. It has to be integrated into the vehicle. If you read the bill and read the law, because I looked at the RSAs and I read it.
Yeah, I don't know. I thought you could use Bluetooth to make the phone call. You just can't. It's a handheld cell phone.
Right, but
You
it
have to
says
put it
must
down.
Bluetooth only if integrated into the vehicle.
But if you're using the headset,
It's not integrated. That's
I
to
guess
itself,
we'll
not
have
the
to,
vehicle.
we'll have to
Have
look,
to see.
look
Yeah,
at that.
I don't know. Yeah, I think the intention was is you can use the Bluetooth.
Yeah.
And you can't touch the cell phone. But Jim's right that as far as it's the strictest in the country because our enforcement officers can't use their cell phones as well.
It's a hands-free provision, I believe. And-
Well, I wish it said that, but it doesn't. It says
Here's really the big issue as it relates to this bill or this law, because unfortunately one of my constituents got involved in an accident where the gentleman was using GPS on a cell phone and ran into the back of her and drove her into oncoming traffic, and the first responder happened to be the woman's father. I mean, it was
remember that.
heart-wrenching.
horrible.
horrible.
And the reality is the way the courts are looking at it is that if you are using your cell phone and you get in an accident, it's just that, an accident. It's not a crime. Mm-hmm. And that was what the court's decision, and the whole town was upset over this. But that's the problem, is it becomes an accident. So by having a bill that's this tight, it says basically is if you that same exact situation, it then becomes a crime.
Well, didn't we already have something in that said it was
Distracted driving.
distractive? And actually, this is the same name of this bill too. Was distracted driving. They didn't put cell phone. They put distracted driving. So we already had something that wasn't being enforced to begin with.
Well, I don't want to hog the show here.
I think that New Hampshire was the only state in New England that did not have a hands-free provision. I'm used to it because I drive down to through Connecticut into New York often enough to visit family that I'm used to it.
Sure.
I feel safer when
I don't believe
I'm not
Massachusetts has it.
looking at my phone.
Yeah.
I mean, if I'm driving behind someone who I can see is looking at their phone or texting,
But that's distracted driving. Technically, they were breaking the law
Yeah.
but
already.
did law enforcement ask us to toughen this law up?
Right.
That's my understanding.
They did, but Massachusetts does not have that law. I think Vermont has it only in certain cases.
In Connecticut, I know. does.
Connecticut's very strict, and I know this because I'm on transportation, so we had to vetted this
Right,
bill.
this was your bill.
Yeah. I actually voted against it only because I thought it just went a little bit too far in the bill. You can't look at your cell phone if
Right.
you're stuck in traffic.
Right,
you have to pull over,
Yeah.
but if you're at a red
Yeah.
light, you can't touch it. So I think it goes a little bit too far, but I mean, I can understand the people that.
Oh yeah, and I understand we needed to do something too, but there's also one little word in there. It says presumed, right? If you read the bill, and a police officer sees a Bluetooth in your ear or sees you pick up the phone, you're presumed guilty, not innocent. I always thought this country was presumed innocent until proven guilty.
Maybe there'll be an amendment.
I don't know. I mean, your cell phone knows exactly when you're doing anything
Yes.
on it, so you're leaving a footprint.
Oh, yeah,
Anytime
absolutely.
you
And if
pick
there's
it
an
up and-
accident involved, they can easily, once you commit a crime, they can take the cell phone and look,
Right.
they have to, they'll take it and look at it. And if you're not doing anything wrong, you don't have anything to worry about, I guess.
I think, like I said, I think that the law, as it was introduced, was to basically take it out of that provision of just an accident and make it a crime. So that's what I'm hearing. But
Yeah,
because
I
I was
just kind of wish they would have went the same route they did it last time with the distracted driving and just maybe increase the fines on that to make it a crime.
There was another instance in Amherst
yes,
where a gentleman was out collecting mail from his mailbox,
Young
and a
man hit
young
him.
man who was texting
hit him.
and
Which was already
killed
against the
him.
law, though.
Right. The texting piece was against the law. and-
Well, distracted driving is how they
well,
labeled it.
texting while driving is against the law on
That
on its
already
own.
was.
Yeah.
Well, the funny thing is, the current law. There's cases. There's two Supreme Court cases. One had someone texting for a long period of time.
right.
I mean, like
Scary.
15 or 20 minutes. I mean, they literally could tell. And basically, by using that criteria, that is the length of the the actual distraction, that was considered
distracted driving.
distracted driving. Okay,
Right.
and she was prosecuted under that provision.
Right.
But say, for example, it leaves it very subjective for the judge that you were just answering a text. And what happens is you took 1 minute away from the wheel, and lo and behold, you had an accident.
Yeah. Right.
That might not be distracted driving. That's just an accident. So by incorporating the bill as it written, I think it doesn't give that much latitude. It says you're violating the law,
Yeah.
and that's the purpose of it. But like any piece of legislation, it can be amended. I mean,
Right.
it's-
Well, it's interesting because originally they talked about eating while you're driving.
Yeah.
Yeah.
Your makeup.
Right.
Yeah.
a
Oh,
pet-
my
a
my
pet on
wife
your
drives to
lap.
Boston every day. She tells me there are people eating cereal,
Shaving,
shaving,
Or how about
reading
reading
the
the
newspaper.
newspapers? Yeah,
Right.
it's like,
But to what point? I mean, we've heard some people call it we're becoming a nanny state because the government thinks they know better than everybody else, and common sense is replaced. So I mean, where's the fine line there?
well, I mean, you bring up that the big one that I'm hearing from other Republicans is the sun tanning.
Oh yeah,
Yeah.
yeah.
The
That
sun
was
tanning
another one.
booths for
Yeah.
people that are children.
18 years of old.
Yeah, you got to
Yeah,
be 18.
that was a Republican
That was
led initiative.
And it was unanimous out of committee.
Yep.
And I talked to people in the committee, the chairman of HHS, and he said there wasn't one person who spoke against the bill, and even the tanning businesses wanted the bill to pass.
Oh.
And the most interesting was the dermatologists that came to testify were all unanimous in that said that the youth skin is not like the same as an adult skin, so they would literally burn at a much higher rate, which could cause melanoma.
Yeah.
Well,
basal cell
interestingly, when I
and-
was chair of the health committee, we had a similar bill.
Yeah.
I think it was a little bit different. It didn't ban 17-year-olds from tanning. It banned up to 16-year-olds from tanning, and we killed it unanimously.
Yeah.
But this goes back 5 or 6 years, and I think in the interim, there's been much more documentation of how skin cancer, serious skin cancers among young people is on the rise. But that's a
See,
tough issue.
that's an example of us working together.
Yeah.
You know, to
A
try-
bipartisan bill. But you know, here's the other thing, the critics who think it's a nanny state is that we don't allow children to smoke.
Right.
I mean, the government is basically
Or
saying,
drink.
or drink, yeah.
But
I
yet we
think
sell
that-
them both.
I think the point
Not
really
legal.
Not to
is how do you
them.
replace common sense
Yeah,
in some
I
areas,
agree.
and more parents need to get more involved.
Oh,
I think
sure.
it's just a question of some people just don't like government to say what they can and cannot do.
Sure.
I think that's where that point it really is. And education, educating the public may go further than a law itself. For
May.
instance, seatbelts.
Right, I was just thinking the same thing.
Seatbelts.
Under the 18, you have to wear a seatbelt.
Right, we don't have the law here in this state, but more and more people are
Helmets.
buckling up because
If you
of
have a
the educational
motorcycle,
piece.
if you have a motorcycle, you don't have to wear a helmet.
Right.
But what happens to people who aren't wearing a seatbelt or aren't wearing a helmet, get in a terrible accident, have a brain injury, and don't die?
Well,
Those people generally are going to have such expensive care that some percentage of them are going to end up on public assistance in the Medicaid program. So aren't we all, actually, don't we all have skin in the game for
well,
people who
New
don't
Hampshire
wear them?
has some of the highest compliance rates for wearing a seatbelt in the entire country, but yet we don't have to. So what it all comes down to is forget mandating things, it's educating people. And I think people in New Hampshire are probably a little better educated on the subject and wear their seatbelts. That's why we wear them. I wear mine.
I do too.
I wear mine out of habit.
Me too. Didn't
My
used to.
children
let
wear them because
anybody
they had to
in
when
my
they
car.
got in the car.
Who
It
won't
depends on
put a
what car
seatbelt?
I'm in. I'm wearing- But anyway,
Well, actually, they told us a few minutes ago that we were at
We're
the
over.
point to...
Oh, we're over?
Yeah, so we're a little bit over
It
right
flies
now.
by.
So
It
it
goes
does.
literally, it flies
And
by.
we could go on for another hour if we wanted to, but at this point, we're probably going to have to end it. So I want to thank you both for being on the show.
Thank you.
And,
Thank you for having
you know,
us.
it's been an interesting show, as always. And while I'll close with this. This has been the Legislators Lounge. You could find us on YouTube if you go to Legislators Lounge on YouTube channel and search it, or our webpage you can find us on the thederrylounge.com, which is on your screen right now, if you want to write it down. All our shows are put on YouTube, so this show will be up there within a few days or so of it being filmed. So with that, I'll close and say thank you and goodbye.